I'm Logan Crawford, and right now on Spotlight, we're talking to the fantastic Dr. Nàdia Correia. She is the esteemed author of Complex Mental Health, The Benefits of Social Prescribing. With a 5-star rating, this insightful work unravels the often ignored complexity of mental health, guiding readers through the winding roads of mental wellness, utilizing the innovative approach of social prescribing. We're delighted to have Dr. Nàdia join us here today on Spotlight, and we ask viewers like you to support writers like her by subscribing to our channel. Doctor, thank you so much for being our guest today on Spotlight.
You're welcome. Thank you for having me in your show.
Our pleasure. This is a fascinating look at mental health and mental wellness. This is a whole new paradigm shift for people. Let's talk and tell the folks at home what social prescribing is all about.
Well, I think social prescribing is something that has been around for some time. We do have some professionals prescribing it, but unfortunately not everyone. So social prescribing is about getting to know what the person issue is, get to know the social events around the person's circumstances, and obviously not just diagnosing the person, but also using resources within the community to support that person to get better, to recover. Let's say, for instance, we have someone going to the GP because they have a headache or because they just feel lonely and they need someone to talk to. So the GP would then prescribe a day center, or they would make a referral to a day center or a peer support group to support that individual in the community, rather than just prescribing medication that would eventually solve the issue immediately. Well, wouldn't solve the issue, would just put a plaster on the wound, isn't it?
Exactly.
This is how I used to say it. So I think basically is to look at each diagnosed differently, and obviously in a person-centered way, using resources available. There are various treatments, also complementary therapies that help the patient's well-being. Unfortunately, they are not being used. We tend to focus more on medication, on prescribing medication, and when we get into this cycle where then we need to prescribe more medication, because then we have more issues, because we have side effects of the primary medication prescribed. So it's all about focus on the patient, looking at resources within the community, and reduce loneliness, and promote physical well-being as well. So exercise and various therapies available, yes.
So basically, this is taking a look at social interactions and social relationships and elevating them to realize that there's actually, quote unquote, good medicine in having people have strong relationships, loving relationships, caring relationships, support within the community. All of that has been kind of pushed aside, in part, I would think, by the pharmaceutical industry, which would rather give you a prescription of a drug to take, as opposed to saying, hey, maybe you need to get involved with an activity, a group, a support center, right?
That's correct. That's the point, really. Obviously, we need to understand that we have certain diagnoses where medication is required. We can't deny that. But there are also other conditions that can be solved using social prescribing, using a more integrative approach rather than medication. I would say, obviously, things like diet, working on our diet, working on our social relationships, keeping ourselves busy. And we know that this by fact. So there are plenty of researches around this topic that prove exactly that those that approach will actually make a big difference in any patient's lives.
Absolutely. There's certain people who are dealing with severe depression, severe anxiety, psychosis, perhaps schizophrenia. Those people certainly need medication. But this is a great alternative for people who would like to try something to improve their mental wellness drug-free. And I think your book and your movement is working to destigmatize getting help for mental health. And tell us a little bit about why you wrote the book and who it's aimed at.
So actually, this book is something that I wanted to do. I wanted to write a book since a few years back. But unfortunately, the way it works back home, the health system is slightly different from the UK. And here I got the opportunity to actually explore things in a different way. But actually, see the views and get the views from not only patients, but also the families. Because you mentioned about schizophrenia, for example, this is a big stigma because people believe that, and this is a very common question to me, people with schizophrenia, they hear voices, isn't it? It's so much more to it. It's not just hearing voices. It's disorganized thoughts, plenty of symptoms that someone will experience. However, it is also known to everyone that people diagnosed with mental health have a very tough life, not just because obviously they have a very complex diagnosis. They take very complex medication, but also because the society purposely excludes these individuals because they are not within the normal, what society portrays as being normal. So yes, I think my aim is to actually bring some awareness, break the stigma, and obviously support the families, professionals, and patients that struggle with mental health and be their voice, really.
Absolutely. And I think you've accomplished that with this book. Tell me a little bit about your practice, the patients you deal with, and your professional work and your professional life.
So my patients, they are all diagnosed with complex mental health, but they also have a forensic background, which means that at some point in their lives, they have committed a crime while they were unwell. Obviously, my job is to make sure they recover within the community setting. So they will be discharged from the psychiatric wards, acute wards, to my clinics, where the staff and the nurses will do the work with the families, other professionals, and the patients, and working towards a recovery model, which includes therapies, key working sessions, review of medication, social prescribing, which is something that we don't see a lot. And my clinics, they were the first ones actually adopting this model. For example, we have a farm where we have therapies and we have horses, and we have a very quiet environment that stimulates recovery away from drugs as well, because unfortunately drug misuse and alcohol misuse has a big impact when misused by someone that already has a mental illness. So I would say that a big percentage of people diagnosed with complex mental health has a history of misusing drugs and alcohol as well, which makes things a bit more difficult. Yeah. So our job is obviously to make sure they are aware of drugs, they stick to the therapies, they stick to the treatment plan in the community, they don't have any mental health relapse, which means that they can have enjoy meaningful activities, see their families, their friends, enroll in university courses, go work. So that's our main work at the moment.
It's a tough time right now because ever since COVID, we've been an isolated society. It's interesting your book is about social prescribing because so many people nowadays rather send a text message than a phone call, would rather send an email than chat with a person in person, might contact perhaps only via Zoom. We're becoming more and more isolated. We're working from home, we're working remotely, we're working by ourselves. So the need for social prescribing, whether it's just a normal lull in your life or a more serious mental illness, seems to be extremely important.
Definitely. I think with COVID, post-COVID actually, we have seen an increase of online shopping and Teams meetings. Nowadays, if we have a professionals meetings, everyone meets up via Teams, so we don't have this face-to-face interaction. And we can see that post-COVID, there was an increase in mental health illness, especially depression, anxiety as well. So definitely social prescribing is the right thing to do at this moment. Especially we see with our children, isn't it? That, if we give them the phone, they stay all day with the phone. They don't care about anything else. So I think people should listen to their bodies a bit more, their minds, and, go out, explore new things. Because what happened, and we have sometimes even non-complex patients that complain about a headache, or they have few kilograms extra, they want to lose them, but we don't see them doing much to tackle the issue. So when, simple solution, good diet, exercise, but there is more to it, obviously. But definitely this is the time for people to start to do something about it. Yeah.
Exactly. And if you're feeling the anxiety out there, folks at home or watching, that sometimes will hold you back. You won't go to that party. You won't go to that group meeting. You won't go to the office if you have an option to stay at home, but do it. Push the social boundaries. It's important for your mental health. Dr. Nàdia Correia has written the book about this. The book is called Complex Mental Health, The Benefits of Social Prescribing. It is a terrific read. It should be on everybody's bookshelf because everyone will benefit from having stronger, better social relationships and following the advice in this book. Dr. Nàdia, thank you so much for joining us here today on Spotlight.
You're welcome. Thank you.
Oh, the pleasure is all mine. And to the folks at home, I'm Logan Crawford, thanking you for your time this time. Until next time on Spotlight.